Who should not have plastic surgery? Well, as a board-certified plastic surgeon, it's my job to educate patients. And I see lots of new consults every single week, but unfortunately, some patients, I have to steer them away from plastic surgery and say no. Here are some reasons why. If a patient is a smoker or actively using nicotine, that is a big no-no for plastic surgery. And I think I've talked about this before. Nicotine is a very potent vasoconstrictor. It causes blood vessels in your tissue that you need for healing to spasm, and it can interfere with healing. It can cause wounds to fall apart. It can cause an increase in bleeding, and in the worst case can cause your tissue to die. So smokers have to quit smoking for at least 6 weeks before we would even consider surgery. Patients that are very morbidly obese or not physically fit are not good candidates for surgery. This would include poorly controlled diabetics, smokers, high blood pressure which is not well controlled, or somebody who could not jog up a flight of stairs if they had to. Being healthy is imperative before having a surgical procedure. And if we think that a patient is not healthy enough to undergo surgery, we will motivate them and say, get fit, try to achieve a healthy weight, and then come back in 6 months to a year, and we can always revisit surgery later. Patients who are not fully informed about all the details of surgery are not good surgical candidates. There's a process in surgery called informed consent, and that means a potential patient needs to fully understand the risks and benefits of surgery, alternatives to that surgical procedure, potential complications, expected outcomes, and downtime. And without a full understanding of what to expect, they should not have surgery. The reason why we spend so much time with our patients in the preoperative consultation, which lasts for about an hour, and in a second visit, a preoperative education visit, which can sometimes be an hour and a half, is that we have to ensure the patient understands exactly what they're getting into, they're fully prepared, they have the help they need afterwards. Otherwise, it's not safe to proceed with surgery. If patients don't have the support they need after surgery, it's not a good idea to proceed. And that might mean help at home, help with their loved ones. They do need to take time off of work, off of exercise, and other commitments. And if they don't have a good period of time, which sometimes could be as short as 2 weeks, and sometimes it can be as long as 6 weeks, then surgery is not a good idea at that time. Lastly, patients should be in a good state of mind going into surgery. If they're having some crisis in their life at that time, that's not a good time to proceed with surgery. I always use analogies when I'm talking to patients, and I say the water should be calm and still going into surgery. There's always going to be things that pop up, but if you're in the middle of a turbulent, thunderstorm, hurricane in your life, figuratively, that's not a good time to proceed. To learn more about planning for plastic surgery and whether you might be a good candidate, visit my website.